In the mid-90s, I really got on board with the endoscopic brow lift, and I followed the evolution of the technique up until the present day. I've known a lot of my colleagues have given up on the endoscopic brow lift. One, I think the release at where the temporal crest fixation takes place was not properly released because those fibers are relatively firm and adherent at this particular location that I'm pointing to. Number two, the fixation of the brow. The endotine holds it in place for several weeks as opposed to other devices that may just not last as long. Number three, I believe in overcorrecting the brow. I tell my patients, you're going to have that surprised look for a week, maybe 2 weeks. And number four, I do release the brow posteriorly, allowing the whole scalp to kind of glide back, and then I fixate it in position, as opposed to only working from the frontal area forward, so that when you elevate, you do have a little resistance to that scalp being maintained in that position, as opposed to having it all glide back. Those are something to consider, and maybe you'll fall in love with a brow lift again and give it some consideration.